Okay, hello Kevin, I'm going to be your nurse today. My name is Danielle. I'm going to pull the curtain to provide you some privacy, and I'm going to ask you your name and date of birth.
Kevin Emmert, 7/9/1993.
I'm going to perform some hand hygiene, and I'm going to assemble and clean the equipment. And today, what we're going to be doing is a mental status check and a neuro check. I'm going to start by asking you just 2 questions about the history. Have you ever had any headaches in the past?
No.
Any type of head injuries?
No.
And anything that you do for an occupation that would be hazardous?
No.
Okay, so we're going to start by doing the mental status check. So I'm just going to assess your level of consciousness, which you're awake. Facial expressions, are you able to smile for me? Okay. And your speech is clear by answering my questions.
Yes.
Mood and affect are also appropriate to what we're doing as far as this assessment. Your cognitive function, do you know where you're at? Could you tell me where you're at?
Yes. At the doctor's office.
And what is the date?
The 10th of
And
October.
the time?
About 5:15.
Okay. Attention span is appropriate. Recent memory is appropriate. Distant memory is appropriate. Are you able to tell me about your last birthday?
Yes.
Okay.
I went to Wisconsin.
Okay. And what did you guys do?
Fishing trip.
Fishing trip. Good. So now I'm going to check the nervous system, which is just like your cranial nerves. So I'm going to hold something up to your nose and just tell me if you're able to smell it.
Yes.
Okay. And what does it smell like?
Pumpkin.
Good. And your optic vision, I'm just going to have you turn and face this way, and you can see the Snell chart, which is the vision chart. And can you tell me the last line that you're able to read on there, starting with letter E?
EHIGBC.
Okay. And are you able to, I'm going to take a cotton ball and I'm just going to run it down the side of your face and just make sure that you're able to feel the cotton ball.
Yes.
Okay. And you're able to chew.
Yes.
Okay. All right. And you're able to squint your eyes for me and smile, showing your teeth. And hearing, I'm once again just going to turn you, and then I'm going to stand behind you. I'm going to have you cover one ear, and then I'm just going to whisper a word and tell me if you're able to hear it and repeat back to me the word that I say.
What? About.
Perfect. And can you do the other ear? Same thing. I'll just repeat words to you and just tell me what you hear.
Why? It.
Okay, perfect. Now we're going to check for your gag reflex, and I'll have you open your mouth and say ah, and I'm just going to look into your throat. Yeah. Okay, and I'm going to just have you shrug your shoulders. Okay. And then are you able to stick out your tongue? Perfect. I'm going to look at your balance now, and I'm going to make sure that you're able to walk in a straight line. So I'll just have you put your heel in front of your toe as such and just walk. Perfect. Okay, are you able to come back to me? Okay, and then I'll have you stand with let's close your eyes and put your feet together. Close your eyes and then put your hands out. I'm just making sure, put your hands straight out. Making sure that you're not swaying. Okay. We're gonna check the coordination Now you can open your eyes and put your finger to your other finger, touch each finger, and then take your finger to your nose. Okay, and then if you can have a seat for me, we'll do heel to shin. So you're just gonna lift up your heel and run it down the front part of your shin. And other side, perfect. Okay, I'm gonna just assess now if there's any pain that you've been having on the upper part. So we're just gonna do like slight touch and make sure that you're able to feel that on your upper part, and then we'll assess your lower part and also if you can feel hot and cold. So are you able to feel that?
Yes.
And does it feel hot or cold?
Normal room temperature.
Okay. And same thing here?
Yes.
And same thing here?
Yes.
Okay. We'll have you stand back up, and I'm going to have you follow my finger with your eyes. I'm going to move my hand up, back out, and down, and left. Okay. And if you want to sit back down, I'm just going to check your reflexes. So we're going to do the bicep reflex, which is normal, the tricep reflex, which is normal, the brachial one, which is normal, the patellar, which is the knee, is normal, and then the Achilles, which is normal. And if I can just have the bottom of your foot and just check the bottom, okay? For the bottom reflex of the foot. Okay, you can stand back up. It looks like we're all done. Any findings? I didn't find anything that was abnormal. Your gait is normal. You were able to follow my finger as far as with your vision. You were able to see on the Snell chart, and memory is not impaired. So that will complete this assessment.